Hello, and welcome to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelly. Now, have you ever had any difficulties with some leaking of urine, or if you laugh, you feel something trickle down in your underwear? Well, I was so surprised because this has happened to me. And I was so surprised that by me having obesity, how that puts me at more risk for having pelvic floor disorder. In fact, obesity is associated with high prevalence, which means an increased risk of high pelvic disorders. And people with obesity or living with obesity present with a wide range of urinary, bowel, or sexual dysfunction problems, as well as uterovaginal prolapse, which is basically the uterus coming down through the vagina. And it is all because, we see these at higher risk in people living with obesity. And so that's why today I invited Dr. Nabila Noor, who is a board certified, fellowship trained urogynecologist and reconstructive pelvic surgeon, to come in and explain all of this to us. Now, Dr. Noor, she's currently practicing at Lee Valley Health Network in Allentown, Pennsylvania. In her practice, she takes care of women with a variety of pelvic floor disorders, such as urinary incontinence, pelvic organ prolapse, fecal incontinence, fistulas, just to name a few. So welcome to the podcast, Dr. Noor. We're so happy to have you.
Thank you so much, Dr. Shelly, for having me. I am very excited to share this platform with you. And thank you for that wonderful introduction. I think, you're absolutely right. Obesity plays such an important role in how it affects our pelvic floor, as we will discuss throughout this podcast. But I'm actually really looking forward to talk to you today because, what you do and what I do is so connected. And on behalf of all my patients, thank you so much for doing what you do because it really, truly makes a huge difference to their lives. So I'm very excited to be here.
Thank you. And thank you for coming on. I really appreciate that. Well, before we get started, tell us a little bit more about yourself. How did you get into this field of urogynecology?
Yeah, so that's an interesting question because when I went into medical school, I actually thought I wanted to be a cardiologist, and look at where I am now, right? But it was really, I think my interest in women's health started when I was in college. I did go to Smith College, which is an all-women's college, really sparked my interest in, being doing something in the realm of women's health. So when I was in medical school and I was going through all my, specialties, kind of rotating through them, I really enjoyed OBGYN, which is obstetrics and gynecology, because it truly is an amalgamation of medicine, surgery, and even a lot of psychology, because, you're dealing with patients at a very vulnerable stage of their life, whether you're dealing with pregnancy, whether you're dealing with patients who have cancer of their GYN organs, or in my case, whether you're dealing with pelvic floor disorders, because all these conditions, or infertility for that matter, all these conditions can have a significant impact on a woman's health at different stages of their lives. And I think the reason I decided to choose the field of urogynecology is because it really allowed me not only to serve my patients and be of service to them, but because of some of the amazing development that has happened in our field over the last 2 decades, primarily, with the advent of various minimally invasive surgery, robotic surgery, we're truly able to fix somebody's problem and give them a completely different life. Very rarely can you do that in many other fields of, medicine. But for example, like you mentioned in the introduction, like leakage of urine, there are surgeries that I'll do, which is 12, 15 minutes, and all of a sudden you're dry. I mean, can you imagine the impact that can have on somebody's life? So that was very gratifying. So that's how I ended up doing what I do.
Yeah, because so many family members who have to have like pads, and it's uncomfortable. So you're absolutely right. Just being dry is amazing. Is amazing. Yeah. Well, for those who may not know, what exactly is your pelvic wall and what can cause you to have a dysfunction?
Yeah, I think that's an excellent question because, we kind of talk about pelvic floor and you kind of have an idea what's the pelvic floor, but what the pelvic floor is essentially, it's a combination of different muscles, your connective tissues, your ligaments, which helps support your pelvic organs. And it essentially forms the base of our torso. torso. So when we talk about pelvic organs, that could include your uterus, your bladder, your rectum, your intestines. So basically the pelvic floor helps support all these organs. So when we talk about pelvic floor dysfunction, essentially what we mean is weakening of those pelvic floor muscles, the ligaments, the connective tissue. And that can happen for a whole host of reasons. Age is a big risk factor. Menopause is a big risk factor. As we're talking about, obesity can cause it to weaken, as well as, things that can cause trauma to the pelvic floor. For example, pregnancy, childbirth, any kind of surgery in that area. So all those can affect the strength of the pelvic floor. And when that support system is compromised, you can essentially have things like pelvic organ prolapse, where your pelvic organs are essentially trying to push through the vaginal wall, or essentially a kind of hernia. Or you can have leakage of urine with laughing, coughing, sneezing, what we call stress urinary incontinence, because your urethra, which is the pipe through which urine comes out, is not well supported. So it can cause a whole host of conditions, which essentially is what I see in my everyday practice.
So how does obesity cause these conditions? Why are they at increased risk?
Right. So with obesity, what happens is you have increased intra-abdominal pressure, right? So because of that excess weight, it's increasing the pressure that's generated in your abdomen, that constant pressure over that pelvic floor, because remember, the pelvic floor is the base of your torso. So that constant pressure can help it to weaken. Also, what happens is, with obesity, because of that compromised pelvic floor, now women can have a lack of support for their urethra, the bladder, and you can develop symptoms such as urinary incontinence, pelvic organ prolapse, and all those. But it's really the increased pressure and that constant pressure on that pelvic floor that causes the damage.
And I know you mentioned a couple of symptoms like the leaking of urine. Are there any other symptoms that people should look out for or maybe pay attention to?
Yeah, no, that's a great question. So, when we talk about urinary leakage, there are two big categories. So we commonly talk about, I think what most women think about leakage with laughing, coughing, sneezing, pretty much any kind of physical activity. So that's known as stress urinary incontinence. But there's also another kind of leakage known as overactive bladder. So those are the patients who may not leak with any kind of activity, but when they have the urgency to go, they can't hold it. They feel like they have to go all the time. And when that urgency hits, they either leak or not able to make it to the bathroom. And so even with obesity, we see a relationship to overactive bladder, because what happens is with obesity, as you know, a lot of women with obesity will have things like obstructive sleep apnea. They can also have a low back issues, and the spine, the nerves that's controlling our bladder is actually coming from your lower lumbar area. So a lot of the times when women have back issues, we do see that it worsens their overactive bladder symptoms. And then similarly, pelvic organ prolapse. Right? When you have that excess weight on your pelvic floor, your pelvic organs are essentially trying to herniate through. So we see that commonly as well.
Wow. Okay. Wow. Amazing. So if somebody's having these symptoms, what is the workup that should be done if they go to urogynecologist like yourself?
Yeah. So I think the first thing is realizing, and I talk about this all the time, that any of these conditions that we're discussing, they can happen with age. It can be common, in fact, more common than we think, because women don't talk about it enough, but they're never normal, whether you're in your 20s or whether you're in your 90s, because I see the whole gamut of this age group of patient population. Never is it normal to have urinary symptoms. In fact, I forgot to mention bowel issues as well, right? A lot of women with obesity can also notice problems with their bowel function. So it's never normal to leak stool. It's never normal to leak urine, pelvic organ prolapse. So definitely start with talking to your primary care doctor. If you have an OBGYN, they can also do a pelvic exam. And if they're not comfortable with treating it any further, then have them refer you to a urogynecologist, which is a subspecialist, somebody like me, because we do go through additional training. And in our training, it combines gynecology, urology, colorectal surgery, so multiple different specialties, so that we're able to provide the most comprehensive care to our patients. So when I see patients with these conditions in the office, or they come to see me as a new patient visit, the first thing I start with is a good history, just like any other, specialty. What's interesting though is sometimes patients may come to me thinking they have one problem, but I always make sure I ask them about their bowel function, what kind of leakage they're having, if they're having any pain with intercourse, if they're having any laxity, do they feel like a ball is coming out? And what you really realize histories is, while patients may think that they have only one issue, and then by the time we're done with history, in my mind, I know that it's going to be multiple different things because they're all related. And then, of course, I do a full, like a detailed pelvic exam. And it's similar to what you may expect at a gynecological or at a gynecologist's office, but it's a lot more detailed because I'm actually doing measurements to look for changes in the vaginal walls. Also, there are tests that we can do to see whether or not you're emptying your bladder properly, and then whether or not you're having leakage of urine. So all that with the history, with the exam, then, we discuss, well, what are the pathologies that the patients are having and what are some treatment options? Because not every treatment is surgical, and similarly, not every treatment is non-surgical. So we discuss all the different options and then come up with a plan for each patient based on what's their lifestyle like, what are they hoping to get from this? And it's different for every patient.
Oh, wow. That's amazing. So definitely I hope everyone's hearing this, that if you are having symptoms, definitely go to your primary care. And then if they can't handle it, then they'll see your gynecologist. Now, you mentioned therapies. It doesn't have to always be surgery. What are some options that you would use to help with managing somebody with pelvic floor dysfunction?
Yeah, and that's a great question because it always comes up. And in fact, it's good that you asked that because a lot of the times the misconception is, oh, I'm going to see a surgeon. Okay, they're just going to do surgery. I don't want surgery, so I'm not even going to bother. And I'm here to tell you that, yes, I'm a surgeon. I'm trained very well to do all the sorts of surgeries that, is going to be good for my patient. But just as much as I love to do surgery, I'm equally equipped to talk about some of the non-surgical options. Because, you're right. Many patients, for whatever reasons, may not want surgery at a certain time of their life. Most of the pelvic floor disorders that we deal with can be treated with some sort of non-surgical treatment options. So, for example, if we're talking about urinary leakage or pelvic floor prolapse or even fecal incontinence. So pelvic floor physical therapy is always a good place to start because it helps strengthen your pelvic floor muscles. We talk about Kegel exercises all the time, but something that I see in my practice, which is always interesting, like patients will come and they'll be like, oh, Dr. Noor, I've been doing Kegel exercise. It's not working. And then when I actually go to evaluate them and ask them, okay, do a Kegel for me, I could tell that they're not isolating the right muscles. So you can Kegel away all day, but if you're not doing it correctly, it's not going to help. It's like working out in the gym, right? You could think that, okay, I'm running on the treadmill, but if your machine is not on, it's not moving, you're not going to lose that weight, right? So sometimes, it's helpful for patients to, either have their physician tell them, okay, what are some of the muscles that I'm trying to contract? What's the feeling that I should have? Or if necessary, working with a pelvic floor physical therapists. So these are specialized therapists. They're all females for obvious reasons because they do such internal work. But these specialized therapists, they deal with essentially pelvic floor disorders. So they have a lot of experience and they have various different tools to make sure patient can understand that they're isolating the right muscles. So they can do things like biofeedback where they can put a little sensor in the vagina, and as the patient's contracting the muscles, they can actually see whether or not they're isolating the right muscles. It's almost like working out in the gym but with a trainer, so they can guide you to make sure you're using each machine properly, doing everything the right way. And then of course the onus is on the patients, right? You can have the best trainer in the world, but if you're not going to be putting in the work, it's not going to work. So that's another thing I tell patients is if you're going to do the physical therapy, make sure at least 2 to 10 sets of repetitions, like starting with 15 repetitions each day. And it takes time, at least 2 to 3 months of good PT before you start noticing some improvement. But that's a good place to start.
Now, when would you consider surgery in a patient? Like was it like they failed physical therapy, or is it like now your symptoms are just too severe?
Right. I know, and I think that's a very individualized question. And I'll tell you why. Because I have patients who come to me, by the time they've come to me, they've already, seen PT, they've already done their research, and they're here now because they want something definite and done. Because surgery is the more definitive therapy. It's something, you do it right now and you'll see the result tomorrow, right? And then I have patients who come to me and they just want to know about all their options. Maybe they're not in the stage of their life where they can commit to surgery and the recovery afterwards. So it really depends. Like I said, I always go through all the different options when I first see patients. And then together we have a discussion like, okay, what are you thinking? Where would you feel like, you want to be headed? And the answer is always different based on patients' responses. Some people may know what they want to do. Some people may need a little bit more guiding. And then together we come up with a plan that works for them. The thing I want everyone to know is that there's no right or wrong answer. It really depends on what your quality of life is. And at the same time, sometimes I'll hear patients say that, am I not too young to have surgery, or am I not too old to have surgery? There's no right age to have surgery either, right? If you're suffering, for example, if you're a 40-year-old mom who loves to go outside, loves to go to the gym, but you cannot do that because you're worried like every time you're going to take your kids to the trampoline park, you're going to have a wet underwear. And similarly, you're not exercising because you're worried that people around you can smell urine, then yeah, even as a 40-year-old, you need something definitive. Similarly, if I have an 80-year-old who is isolating themselves, is missing her daughter's, or grandson's graduation, or, not socializing anymore because she has to wear a diaper, that's not a way to live. Definitely talk to your providers so that they can talk to you about the different options.
Oh, yeah. Now, I know one common option that you all do as far as surgery is either like the sling and the mesh surgery. Is that the same thing, or is there two different types of surgery?
Yeah, so the sling surgery is essentially it's the same as mesh surgery. So mesh is the material that the sling is made up of. So it's essentially made up of something called polypropylene. So we kind of use it interchangeably, like mesh surgery or sling surgery. But mesh can also be used for prolapse surgery as well. So when we're talking about sling, so that's a form of treatment for the stress urinary incontinence. So that's the leakage with laughing, coughing, sneezing, any kind of physical exertion. So this particular surgery has really changed how we treat women, because we started doing this as of the mid-90s. Because prior to that, a surgical treatment for stress incontinence would be a major abdominal surgery. Mm-hmm. But with the advent of this sling, really all we're doing is we're making a tiny centimeter incision through the vagina. We put this tiny piece of mesh. Surgery is done in 12-15 minutes, and patients do amazingly well. Early in 2000, there were a lot of controversies about mesh. And when patients come to see me, I do spend a significant amount of time talking to them about some of that history, making sure they feel reassured. But in short, in summary for our audience, mesh has come a long way since the early 2000s. And like we were talking about earlier, like my specialty is such a new specialty. And that's because we realize it's so important to have specialized surgeons who have extensive training, who can treat these particular conditions, as well as deal with complications when it happens. So now that urogynecology is a whole other board specialty, those of us who do these kind of surgeries, we have a lot of training, a lot of experience, and that has significantly improved outcomes, and patients do amazingly well.
Oh, amazing. Now I have one more question here. So I had a patient who had a pessary. Mm-hmm. Does the pessary help, or is that not something you should do? I know there's probably some cons or side effects with it.
Yeah, no, absolutely. So pessary is another form of non-surgical treatment options. And in fact, so for the audience who may not know what a pessary is, it's essentially a silicone device. The most common one that we use looks like a little donut, like a plastic ring. They come in different shapes and sizes. And essentially, it's a vaginal insert. And the idea is you put it in the vagina to help support the pelvic walls. So it can help women with leakage of urine, so stress urinary incontinence, as well as pelvic organ prolapse. The thing about pessary, or the thing to know about pessary, is it is something that has to stay in the vagina all the time for it to be effective. Mm-hmm. So for a lot of my young patients who may be sexually active, it can be a little bit cumbersome because they have to remove it for intercourse. It does increase your vaginal discharge. And sometimes the silicone just rubbing against your vaginal wall, especially for my patients who are menopausal, where the tissue is already thin, can cause some bleeding and discomfort. Having said that, if that's the route patients want to go, then there are ways that we can counter some of those issues. And I have many patients, especially my older patients who may not want surgery. It can really be very helpful for some of them.
Well, thank you so very much, Dr. Noor, for coming and just teaching us all about pelvic floor dysfunctions and how we should treat it. And definitely want to, for those people who are experiencing this, definitely I recommend to see your doctor about what are other treatments you can do. But just before we end, can you maybe share any last minute strategies, tidbits, or just advice advice you want to leave with the audience?
Yeah, so I think, it's important to know that pelvic floor dysfunction, whether we're talking about urinary leakage, prolapse, bowel leakage, as we discussed, can happen, but there's no reason to suffer with it. Talk to your primary care doctors, have them refer you to a urogynecologist. Let's talk about the treatment options. If you want surgery, there are amazing surgeries that we can offer, like we discussed, with minimally invasive techniques, and patients do well. Most of my patients go home the same day. But if surgery is not for you, there are non-surgical treatment options as there as well. What I don't want patients to do is like, okay, I don't want surgery. I'm just going to suffer with it for the rest of my life. That's what I hope that the patients can take, it's never normal to be having these conditions. And especially in today's day and age, there's really no reason to suffer with this.
Well, thank you so much. Before we end, how can someone work with you?
Yeah, so like you said, I'm currently practicing in the Allentown area. So if you're in my neighborhood, please find us. We'll be happy to take care of you. I am starting to be more active on social media. So I do have a YouTube channel that I started. And, it's actually, based on recommendations from my patients, because sometimes they'll be like, I saw so-and-so's video. You should do one video too. So I'm starting to do more kind of educational videos of, little topics, just like we were talking about today, so that, patients can go back and review it. So by all means, check it out. You can always find me on social media, Instagram, Facebook as Dr. Nabila Noor, and that's the same handle for my YouTube as well.
All right. Well, thank you again, Dr. Noor, for coming on today. And thank you all for joining us on the Back on Track Achieving Healthy Weight Loss podcast. If you like this episode, please share it with others, like it and subscribe. And don't forget to leave a 5-star review. And we'll see you all next time.
Thank you.